And speaking of that new CDC guidance, a lot of healthcare workers are not on board with it. Joining me now is the American Nurses Association president, Dr. Ernest Grant. Thank you for being with us, doctor. What worries you about these shorter isolation guidelines?
Well, first of all, thank you for having me. And what worries us is that we believe that the guidelines are premature, given what is known about Omicron. It seems to tips more towards, economic needs, as opposed to taking into consideration the health needs of nurses and other members of the healthcare team. We believe that, well, keep in mind there are two sets of guidelines. On December 23rd, the CDC issued guidelines for healthcare workers, and then I believe on December 28th, they issued guidelines for the general public. But for healthcare workers, we believe that there needs to be more accessibility to testing, as well as employers continuing to provide the protective PPEs that need to be provided. We're hearing in some cases that still is not the case. So this is especially problematic when reliable testing is not available, particularly in some places that may be experiencing a surge. And currently, healthcare workers, they either have to go to a local site in order to get clearance, as opposed to maybe going to their employee health, because in some cases, employee health personnel, they're still working remote. Or if they are working, they're working 8 to 5. So for someone who may be working the 11 to 7, 7 p.m. to 7 a.m. shift, they would have to make a special trip to get tested, to have that assurance that they are testing negative before they can return to work.
Look, you represent 4 million registered nurses. Healthcare workers were already burnt out. Now we're in this winter surge. We talked to a doctor last hour who said it's going to be a very long, hard January. What is the impact already on your members?
Well, the impact is that, as we've been saying since March of last year, actually, that nurses and other members of the healthcare team are experiencing extreme mental fatigue. We hear from nurses on a regular basis, I'm supposed to be working a 12-hour shift, but my 12 hours turns into 14 or 16 hours. I'm only getting 1 day a week off because my employer is calling, asking if I can work overtime or there's mandatory overtime. And with this new guideline that the CDC has put out, one of the things that we're encouraging is that there should be testing before they go back to work. Otherwise, you have people who are returning to work who may have a cloud over their head asking themselves, am I still infectious? Or if I'm a nurse and I take public transportation into work, again, you're re-exposing yourself to someone that you don't know that may or may not be positive. So that creates, quite a conundrum as well. But for the most part, this is just continuing to the extreme mental and physical fatigue that nurses are experiencing.
And our hats are off to them. Dr. Ernest Grant, thank you so much for taking the time to talk to us today. And